Hello, hello. Welcome to Following Science, the podcast where we delve into the latest and most fascinating topics in science. I'm your host, Rutu Ruparel, and today we're going to be exploring telemedicine and its impact on cancer care. Now, without wasting any time, let's dive right in. Now, let's start by picturing a scenario where a patient diagnosed with cancer resides in a rural area far away from specialized medical facilities. Now, the nearest oncologist is going to be hours away, and the patient is unable to make frequent trips, either due to financial constraints or due to just physical limitations. This scenario was once a daunting reality for many individuals facing cancer. However, with the advent of telemedicine, the landscape of cancer care is undergoing a revolutionary transformation. Now, in today's episode, we're going to explore how telemedicine is reshaping cancer care, from diagnosis to treatment and survivorship. We're going to delve into the technology behind it, its benefits, its challenges, and hear different scenarios of such real life patients who have experienced its impact firsthand. Now, let's dive right in. First, let's begin by understanding what telemedicine is. Telemedicine refers to the remote diagnosis and treatment of patients using telecommunications technology. This means that instead of physically visiting a doctor's office, patients can have consultations via phone, video calls, or even through specialized apps. Telemedicine can also help manage urgent calls after a doctor's office is closed. It is immensely valuable in the follow up of patients with chronic diseases such as diabetes, high cholesterol, or high blood pressure. Initially, telemedicine in healthcare was implemented using specialized video conferencing equipment with customized diagnostic peripherals, such as stethoscopes or EKG monitors, attached to the system. The healthcare provider with the patient would then use these diagnostic tools under the guidance of a distant physician to provide the required patient data, which was effective at first, but it just became really bad afterwards in the sense that it was super inconvenient, which is why now, with the advancements in technology, telemedicine has become so much more accessible and so much more user friendly. Typically, now it just employs a desktop to computer with a special video card, or even just a smartphone or a tablet with good internet connection. Super convenient. Now, let's go into discussing some benefits of telemedicine. As I mentioned before, it's just incredibly convenient. Patients no longer need to travel long distances or sit in waiting rooms for extended periods. This is particularly beneficial for people living in rural areas or those with mobility issues. It also significantly reduces waiting times and expands access to high quality medical diagnosis and treatment. For instance, a patient in a small town can now consult with a top specialist located in even a different city or even another country. Another major advantage of telemedicine is its cost effectiveness. Telemedicine consultations generally cost less than in person visits. This is a crucial factor for many patients, especially those without comprehensive health insurance coverage. Moreover, telemedicine provides flexible scheduling, allowing patients to book appointments at times that are most convenient for them, which can be particularly helpful for those with busy work schedules or with caregiving responsibilities. Now, let's talk specifically about telemedicine in cancer care. Let's go into a scenario of a 7-year-old girl, Eva, who was diagnosed with advanced Wilms tumor in 2020. Chris and Alicia LeBone, her parents, sought out a second opinion on Eva's treatment from doctors at Vanderbilt Ingram Cancer Center, or VICC, in Nashville. But instead of making a 2.5 hour drive, which they would have had to take the entire day off for, to go to Nashville, they just hopped on a video call with pediatric oncologist at VICC. For families like the LeBones, the option to see healthcare providers virtually is reshaping their entire cancer care experience. Because although it can't completely replace in person care, telehealth does offer patients convenience, time and cost savings, flexible scheduling, access to specialists far away, and what many patients and doctors describe as intangible benefits, such as reduced exposure to germs. Now, in addition to these benefits, telemedicine is making a significant impact on the mental and emotional well being of cancer patients. The ability to consult with their healthcare team from the comfort of their home can reduce anxiety and stress associated with these hospital visits. It allows for a more relaxed and familiar environment during consultations, which can be particularly comforting for children and elderly patients. Now, while legislative efforts to expand telehealth continue, many people with cancer have reported high satisfaction with their telehealth visits. And according to available data, that appears to be true for certain needs and has been showing a positive trend in certain aspects of cancer care, such as cancer genetic counseling. This aspect of telemedicine has shown promising results and is providing personalized care and helping patients make informed decisions about their treatment options. Now, beyond telehealth visits by phone and video, another component of telehealth where interest is surging is remote monitoring of patients' symptoms via mobile phones and other devices. This technology enables healthcare providers to keep track of their patients' health in real time, allowing for timely interventions and adjustments to treatment plans. Remote monitoring can include tracking vital signs, medication adherence, and reporting side effects or new symptoms. For example, a patient undergoing chemotherapy can use a mobile app to log their daily symptoms, which are then reviewed by their oncologist. If any concerning patterns are detected, the healthcare team can quickly reach out to the patient to address the issue, potentially preventing different complications that could occur and just improving overall outcomes. Now, telemedicine is obviously not without its challenges, just like everything else. There are concerns about the digital divide, where some patients may lack access to the necessary technology or reliable internet connections. Additionally, there are issues related to data security and privacy, as well as the need for proper training for both healthcare providers and patients to effectively use telemedicine tools. But despite these challenges, the potential benefits of telemedicine in cancer care are undeniable. It represents a significant step forward in making healthcare more accessible, efficient, and patient centered. Now, as we wrap up today's episode, I just want to thank you all for joining me in this journey into the fascinating world of telemedicine and its impact on cancer care. If you enjoyed this episode, please subscribe to Following Science and leave us a review. Your feedback helps me bring you more engaging and informative content. Now stay curious, stay inspired, and keep following science. Until next time, I'm your host, Rutu Ruparel, signing off.